Good morning, everybody, for our last and final class on the introduction to human genetics. Today's class is going to be a little bit different in that this is really a class participation activity where you guys have been examining the pros and cons of a couple of ethics questions, and we're going to have some debate. We will be turning off the recording at the request of the students during the debate, but before we get to the debate, we're going to introduce a case. So we'll go through the case of the class, and then for the remainder of the session today, we're going to turn off the recording. Anyhow, this is the last final class. You guys have been a wonderful audience. I really appreciate you guys being here to help us by providing your valuable critique into the class as it's been forming. And so today, again, a little bit different than usual in that there's no didactic other than a brief case presentation. We're going to be debating these two questions. Number one, should parents or society have the right to select or enhance certain genetic traits, in other words, to create designer babies with respect to sex, intelligence, athleticism, etc., for their offspring? And then the second question we will be debating today is, who has the right to know your genetic information? Parents of minors, other family members, insurers, employers, etc. In the reference section of today's slide deck, let me zip down there for a sec. I've included a reference to the Genetic Information Non-Discrimination Act, which we won't be talking about today, but it's there for some background. Really, I wanted to focus more on the debates today. So for today, again, we're going to do the debates, and we're not trying to sway anyone in your position on these questions, but really what we're trying to do today is let us each inform each other about various viewpoints so that then we can go off and be better able to formulate our own opinions. So what we're going to do today is present a case of Huntington's disease. We've talked about Huntington's disease already, but there's an interesting ethical debate that came up recently in the news. And then we'll go on to the different debate topics. So here is our case for today. We have a 45-year-old man. He presented initially with declining memory and concentration, and as his intellectual function deteriorated during the ensuing year, he developed involuntary movements of his fingers and toes, kind of like what you see in this Frank Netter picture shown here. He developed these involuntary movements of his fingers and toes, as well as facial grimacing and pouting. He was aware of this condition and became depressed. He had been previously healthy and did not have a history of any similarly affected relatives. His parents had died in their 40s in an automobile accident. He had one healthy daughter. And after an extensive evaluation, the neurologist diagnosed this man as having Huntington's disease. And you may remember we talked a little bit about the genetics of Huntington's disease. And I think just to add a little bit of a flavor to this before we get into the genetics debates, I'll take you through a little bit of that. But here again in this picture, you see some of the movement disorders that characterize Huntington's disease. This is also accompanied by mental deterioration. And here's a pedigree that we've looked at before, illustrating something we call anticipation. And one of the things you notice in this pedigree is that with successive generations, the age of onset of affected patients gets earlier and earlier. And so it's this strange phenomenon called anticipation where the onset gets earlier with successive generations. And when Huntington's disease, when the etiologic basis of Huntington's disease was discovered, it was recognized that in this particular gene, the HTT gene, which codes for a protein called Huntington, there's a stretch in this particular gene of these short tandem repeats, these CAG trinucleotides. And this is in an exon of this particular gene. And people vary in the number of these CAG repeats that they have. Normal is less than 27, intermediate is 27 to 35. And once the number of repeats hit above 35, these patients can manifest or will manifest Huntington's disease. And as the number of repeats continues to climb, that correlates with an earlier age of onset. And so what's happening is these CAG repeats are unstable. And the presence of this high number of CAG repeats predisposes to even more of these CAG repeats in successive generations. And that is the basis for anticipation. It's that, the grandparent has, say, 42 CAG repeats, but then their offspring might have 50 CAG repeats, and then their offspring might have yet additional CAG repeats. So we have a man, he's 45 years old. Our patient happened to have 43 repeats, and so he begins having symptoms of Huntington's disease. But of course, this is long after he's had his children, and that's one of the challenges with Huntington's disease, is that the disease lies quiescent until long after the reproductive years. And so we have a case here where this man is diagnosed with Huntington's disease, but he refused to let his doctors tell his daughter. So his daughter didn't know, and she went and got pregnant and had a child. And after her child was born, she then learned of her father's condition. And she then subsequently learns that she inherited the Huntington's gene. And so a couple things. She chooses to let her child decide about testing when she turns 18, but she also wins the right to sue her doctors because she claims that had she known, she could have considered prenatal testing, she could have considered termination, etc. So I thought that this was a nice case to illustrate some ethical issues. Did this man's doctor have an obligation to inform family members about this gene, about this mutation that wouldn't actually manifest until after his daughter's reproductive years? So with that, we're going to launch into our first debate topic. I'm going to say goodbye to the recording, and then we're going to go ahead and get started.